Hi, everybody. Welcome back to another episode of Vetsplanation. I am your host, Dr. Sugerman, and we have with us again our crazy cat vet. Thank you again, Dr. Cherna, for joining us today.
Thank you so much for having me here today again. I'm very
Yeah,
excited to be here.
absolutely. So, we're going to be talking today about pain in cats, and then somewhat of a related topic. We're going to talk about arthritis in cats. So, we'll start out with just with pain because I feel like with people, we are very dramatic, right? Compared to an animal, we're very dramatic about our pain. Even dogs, I feel like, are a little bit dramatic sometimes, especially like huskies. I love them, but anytime they stub their toe, they're screaming. Cats are just not the same. It is really hard to tell if a cat's in pain, even for us as a veterinarian. So, can you describe to me, like, how can we tell if our cat is in pain?
Yeah, absolutely. I think that's a huge difference between, like you said, humans. So my grandma always used to say that the deadly disease of man is cold. So every time
Yeah.
like grandpa would have a cold, it would be really bad. And then
Yeah.
I feel like we can really tell. But cats, when I look at cats, I always consider them in nature, they would be both predators, but also prey.
Mhm.
So they are, of course, amazing hunters, and but they also are prey, and therefore they really try to hide often when they are in pain or when they're vulnerable, because of
Mhm.
course that would just put the other predators potentially at more tempted to want to hunt them. It's
Yeah,
why
they're very unique in that way.
absolutely. Cats, they are very, very brave creatures. They have 9 lives. I strongly believe in that
Yeah.
because the things I have seen cats pull through, I don't think anybody else could. But they
Right.
definitely try to hide pain, which is a big problem for us as doctors, of course, veterinarians, because we are struggling and clients as well, the caregivers of cats. They really struggle to recognizing that their cat is in pain and they need to bring them in.
Yeah.
Yeah, so
And
the main signs I think to look for really is I, for example, think it can be as subtle as literally just a tiniest change in the behavioral of the cat.
mhm.
So, for example, my the love of my life, Belina, she sleeps
Yeah.
with me literally on my neck, behind my head, every single night. And then one night she just wasn't there, and I was like, "Oh, that's so weird. I wonder what's going on with Belina." And then I went downstairs in the morning to make my coffee as always, and she just wasn't looking right, and I looked at her, and then she had a horrible cat bite abscess actually because she was in a fight with
Oh,
one of my
no.
cats the day before, which was horrible,
Yeah.
and that cat no longer lives with us.
Ah, okay.
But yeah, he has a great new home with one of my friends because they just
Yeah.
were not getting on well. But yeah, so it could be as subtle as a tiniest change in their behavioral all the way to then, of course, eating a little bit less potentially. They can be seeking less attention usually. Usually, they wouldn't be like looking for attention more. Sometimes that can happen too, but most of the times it could be hiding, trying
Mhm.
to sleep a little more, potentially eating less as well, and just not doing their routine stuff.
Yeah, so isolating themselves more than they normally would, right? I feel like
Exactly.
that's probably one of the top things that people bring their cat in for when there's no other signs, there's not vomiting or anything. They'll bring them in and just say, "They're just not acting right. They didn't sleep with me tonight," or they're hiding in a weird place that they've never been before. Yeah.
Yeah, cats love their routine stuff. So I know when I come home, I know where is the. I have 6 cats, and I know where is the favorite spot of each of my cats to sleep, to rest, when they
Yeah.
eat, when they don't eat. So it's just cats. They love their routine stuff. That's why I love them so much because they don't like changes. So when something
Right.
are changing their routine, there's definitely something going on with them.
And do cats cry out in pain?
It's a great question. They definitely potentially could be meowing and be more vocal if they're in pain, but they definitely are not usually yelping like dogs would be. Every time you work in an ER, so you probably see a lot of those dogs with pancreatitis and a lot of other issues or broken bones, and they come in and they will be yelping and really
Right.
showing how painful they are. And cats just don't really do that. They can
Mhm.
maybe be like trying to meow and show us that there might be something going on, but most of the time they don't. Cats can actually interestingly purr when they're in pain.
Mhm.
So, purring is one of my favorite sounds in cats, but cats can unfortunately purr also when they're in pain, and that's always very sad purr.
Yeah, I did a whole podcast on, like, why cats purr, and one of the things was talking about how, they're purring to, like, self-soothe themselves or even potentially to try to heal themselves with purring just because of, like, the sound wave that it
Yep.
that it comes
Mhm.
in as.
Yep.
Yeah, which is really
Exactly.
cool.
Yeah.
But a lot of
Cats
people would
actually
mistake that for,
yeah,
like, they're
exactly.
purring and they must be happy, not in pain.
Yes, and they purr very often also because I breed cats, so when they give birth, when they have those
Mhm.
contractions, they really are trying to, like, breathe through them, and I think that's really helpful, like you mentioned, those, like, waves and stuff, I think it potentially really helps them with that pain in during labor.
Yeah, yeah. So amazing what they do,
Yes, are the best creatures.
right? And we were talking about, are
Yeah.
they vocal when they're in pain? I will say, like, one of the top things that I see them vocalizing or just screaming for is when they have the aortic thromboembolism or saddle thrombus, where they, like, have a blood clot that goes to the back legs, and for blocked cats who have urinary obstructions. Those are the 2 things that I think I've ever heard a cat scream for. Even broken bones, they are gonna try to walk on it.
Yes, I was just about to say that actually. The aortic thromboembolisms, those are one of the saddest cases I've had because I think those cats
Mhm.
are really just so much in pain.
Right.
And I think for us vets, it's really important to recognize that and really provide them immediately with some pain relief as well.
Mhm.
But I agree. Absolutely. And I think obstructed cats do that as well often, but I feel not always. But the aortic
Right.
thromboembolism cats, I feel like they always are crying out loud, and that one is
Yeah.
probably very painful condition.
Exactly. When you're like, you can break a leg and not be as
Yeah,
painful to scream, but like that, those aortic thromboembolisms, they're definitely screaming.
absolutely. Yeah, like you
Yeah.
said, yeah, I see like lame dogs, it's crying and they will
Right.
just walk and cat with a broken pelvis even
Yep.
after car accident, they are still like walking around and it's
Yeah,
just like
exactly.
yeah, I always tell people that cats know that there are unfortunately so many creatures, but also humans that do not like them. And
Mhm.
they just want to live despite all those odds and they just have this amazing will to live.
Yep, exactly. When we do recognize that they're in pain, is there any way to comfort them for that pain?
Yeah, I think this very much depends what type of pain, of course, this is, because I
Mhm.
think if it's an acute pain, those ones, because of all the physiological processes that happen with those inflammatory cytokines, for example, and everything, a lot of these patients really need to be brought in and for us to be able to help them with medications, because a lot of the
Mhm.
acute pain can be really quite challenging to manage, I think, at home. But for example, then when we go and we'll talk a little bit more about the osteoarthritis in cats, like those chronic pains, we can actually make environmental changes at home and make modifications and adjustments that can help these cats, maybe even improve their needs for needing less pain medications and everything. So I think with the chronic pain, we should really not underestimate it, but I think we could probably do some modifications for them to be able to cope better, especially with osteoarthritis that we will talk about. But I think with that really acute pain when those cats are not feeling well, I think it's really important to bring them in because I, for example, had because cats can develop, and you probably see this a lot in the ER, they can develop the hepatic lipidosis. So these fatty deposits in the liver if they stop eating. And
Right.
especially those overweight or big cats, when
Mhm.
they stop eating, they start using their fat for energy and then therefore, of course, they will have these fatty deposits in the liver, which is of course a huge and even life-threatening problem for these cats.
I usually tell people people are always asking, "My dog didn't eat for 24 hours, is that okay?" And I'm like, "Yeah, dogs cannot eat for a week, I'm fine with that.
Y-
If a cat stops eating for 24 hours, then I'm very concerned."
Yeah, I am too. And I actually, one of the worst cases I've ever had of hepatic lipidosis was a cat that was this 2 or 3 year old Maine Coon cat that had a TPLO for her
Oh,
cruciate. And the cat
mhm.
was a little lame before, compensating, doing pretty well. Then
Yeah.
she had her knee surgery, and then the cat was in so much pain and uncomfortable with those plates. The cat stopped eating, actually developed hepatic lipidosis, became constipated, and actually was brought to the vet. And because it was a Maine Coon with unfortunately some HCM, she got fluid overloaded. So then she was in congestive heart failure. We pulled her through it, but that was a horrible complication of a TPLO surgery in a
Right? Seriously, yeah. All to try to fix one part that was painful.
yes, and then we caused
Yeah.
this whole sequel of problems for her
Ugh,
after that.
poor thing.
Yeah. Yeah. So definitely if you're concerned that your cat isn't acting right, definitely bring them in because it's an emergency most of the
Yeah,
times.
yeah, great. Was there anything else you wanna say about pain first before we move on to arthritis?
Yeah, I think I would just really try when you bring these cats to the vet because of course it's first time we see the cat when they come to us and this from your experience sometimes for us it can be really hard because cats can be very stoic to really
Yeah,
tell. So I think it's really even the smallest thing potentially can help us try to see what might be going on with the pet because I wish I could ask the cats. I wish I spoke cat language and
right?
meow and if there was any way I could learn that, I absolutely would. But for us,
I feel like
it's
if
really
anybody
hard.
could, it would be you.
I love that. Yes, I wish. If I could have one superpower, it would be to speak
Right.
meow. But yeah, no, I think that would be like really, really important for us to really know just the smallest changes because we'll touch their belly and dogs with pancreatitis will be super painful. In cats, it's so hard to tell as well. So really important just always telling us what you think might be going on or what's happening with your cat because I think the owners or the caregivers always know their cats the best.
Mhm, exactly. And I think also on that point, just making sure whoever does know the cat the best is the person that brings them to the vet. Because sometimes you'll have a child or somebody who just doesn't do a lot of stuff with the cat. Well, they come in and what's going on? I don't know. It's just not acting right. That's so much harder for us when they don't give us the signs that we need to when we're doing our physical exam to try to figure out what's going on.
Absolutely, yeah. So please always, and if most of the times it's always, and again, I am a big feminist and I don't want to be insulting to anyone, but always if it's usually like the husband who brings in the cat, we call the wife and he's always like, I'm just the driver or the
Yeah.
personal taxi driver for the cat. You need to talk to my wife. So that always makes me
Right.
laugh. So
Yeah.
yeah.
Perfect. Anything else about painting cats?
I think we've covered quite a lot of it actually, and I think we should maybe
Perfect.
talk about the osteoarthritis and actually
Yeah.
recognizing also the chronic pain and maybe the management of pain as well in cats.
Perfect. So tell me what is osteoarthritis first?
Yeah, so cats, so we call it now more degenerative joint disease because cats can actually have arthritis also in their spine. And so
Mhm.
there is also this use of the words. So we probably are a little bit more inclined of using the term degenerative joint disease now, so we can cover the spine as well in these patients. And unfortunately, sometimes as kids get older, and we see that in humans as well, our joints, of course, are losing the kind of the flexibility. There potentially could be a little bit more friction. Sometimes the bones, as they touch each other for many years, they can become a little bit more fragile as well. So all of these can, and there could be some inflammation in the joints, of course, as well. So
Okay.
all of this can trigger pain in cats. And then they can have decreased mobility. So very often what we see in these cats are changes, for example, in jumping up or down. Sometimes these cats are slowing down. They don't want to sleep anymore in their favorite places. So like my cats absolutely love sleeping on their windows. And if they do not have an access and they would have to jump really high to go and sleep on those windows, that could definitely be an issue. Sometimes if you pet them on the back, they can be a little bit uncomfortable if you touch them in some area. So definitely sure noticing that as well. And they usually still eat and otherwise feel okay, but they could be some changes in their appetite as well. But most of it is really, again, those subtle changes of maybe they don't. I've had a client who told me, you know what, my cat always used to sleep in bed with me, and now I have bedroom upstairs, and the cat doesn't want to go up the stairs and jump into the bed as she used to because she is sore. So these are all these little things. And then the client was very sad because he lost his wife and he only had that cat. So he was like
No.
very upset that his favorite person almost our
Right.
favorite creature in the world doesn't want to be with him at night. And then so we started medications for the osteoarthritis and then he was just so excited that his cat comes back to bed again.
Good. Good. Nice. Yeah. And with arthritis, it seems like it's a slow progression for people who are really paying attention to all those little tiny details. I feel like sometimes it becomes a big thing, like not wanting to jump in the bed when it's progressed pretty far, right?
Exactly. So it really
Mm,
will start. And I watch because I have a 10-year-old cat at home now. So I watch her a lot because sometimes I feel like she is a little bit uncomfortable when I palpate her spine. So we are carefully watching that, assessing that as well. She's a huge pain with taking medication. So I I haven't we tried doing it like a gabapentin trial, but she also has mouth allergies, and I've been trying to give
mhm.
her some antihistamines now. And sometimes I just feel like the stress because she's a brachycephalic cat, so she has this smashed face. So
Yep.
every time I try to medicate her, she goes into this little bit of respiratory distress. She
Well,
really is
no.
getting upset, and then spitting the food all over, and then she doesn't talk
Right.
to me for half of the day. But there are always definitely ways we have to find some balance, right? Because
Right.
sometimes giving cats all these medications, maybe it's not improving their quality of life.
Exactly.
We always really need to find that balance there. But yeah, I think just really watching your cats and making sure that there are not any huge changes in their lifestyle is important.
Yeah. Yeah, exactly. I had a cat last week that the guy said that the cat just takes pills and pill pockets. 'Cause he asked me specifically for pills and not liquids, and I was like, "What? Y Your cat is not a cat. I don't I don't
Yeah.
understand." Yeah. That is amazing.
No, and I try now, like when I breed kittens and stuff, I actually teach them to take like empty capsules in churros and
Nice.
stuff.
Mhm.
So we definitely are working on that quite a lot because I think it's really important that cats are really exposed to these treats and be
Mhm.
motivated when they are young. So when they develop all these diseases when they are senior cats, so we have options to give them medication.
Yeah, that's a great idea to do that.
Yeah.
Yeah. So are there some cats that are more predisposed to having arthritis than others?
We always see it a lot, of course, in domestic short hairs. Absolutely. But it's also one of the most common breed of cat, of course.
Right.
But these large breeds of cats, like Norwegian forest cat, Maine Coons, British short hairs, these cats can even have hip dysplasia, actually, which we don't talk about very often in cats compared to dogs. But I actually was part of my PhD back in Czech Republic. I actually looked at prevalence of hip dysplasia in pedigree cats there. And it was surprisingly really high without the clients not noticing any clinical signs at home. So it really sometimes can be these signs can just be very subtle, and this only shows us how often we miss these signs at home. And so potentially these like larger breeds, and unfortunately, probably the worst breed for this. And I think there are definitely ethical concern about even breeding this breed are Scottish Folds,
Mhm.
because in Scottish Folds, the cartilage defect that makes them have their ears so cutely folded is actually a defect in their cartilage, and it affects their joints as well. So I have sadly seen 4 or 5 month old kittens that are too painful to jump on a sofa, and it's
Oh,
heartbreaking.
yeah. Oh, so sad.
Yeah.
Yeah, what about if your cat is just overweight? Does that predispose them to having arthritis as well?
Absolutely. So thank you for bringing that up. Absolutely. Yes. So we always, of course, when I actually just made this big post on my Instagram about feline obesity last week, because, of course, unfortunately, this is one of the bigger problems, and being overweight predisposes you to a lot of different issues, and osteoarthritis is one of them.
Exactly. Well, what are some of the best things that we can do to help these cats who do have arthritis at home?
Yeah, environmental modification is very, very important. So I had actually a lot of my clients that build these like cute ramps so the cats
Mhm.
can like still go on the windows. And I've had one cat that had a quite severe osteoarthritis, and so they then wanted to hang out in only one room. So the caregivers brought all of her main resources, right, like litter box, food, water,
Mhm.
toys, bed, and had these like special, really, really fluffed cushions for her to sleep
Yeah.
indoors and everything. So environmental modifications and management for these cats makes a huge difference. Like I
Mhm.
have like little, because I have these automatic litter boxes. So now for my 10-year-old, I actually they sell this little like ramp to it, like stairs, so she
Mhm.
doesn't
Yeah.
jump up into it. So I have those, so
Nice.
it's more comfortable for her to use it. So environmental modification is very, very important, but
Mhm.
very often we reach for different pain medications as well.
What about, like, warming
Mhm.
things? I saw, like, a warming blanket the other day at the pet
Mhm.
store and, like, little warmer beds and stuff for them. What do you think about that?
I think they are wonderful, especially in these older cats because they are also losing muscle mass. So they
Mhm.
really are struggling to keep up their body temperature as well. So I absolutely love those. I actually have a heat pad in my bed for myself because I have low blood pressure and I'm always cold. And
Yeah.
my cats absolutely love it. So they're all using it too. So cats
Nice.
love being warm, right? Like cats
Right.
really do not enjoy like roaming around. And some cats will love to play in snow for a little bit in winter,
Mhm.
but they are not like, I want to be by my fireplace. And if you see that, like those pictures of those happy cats that have like their
Mhm.
heat pad in front of the fireplace in this super nice soft bed. I just think with the heat pads, it's really important to make sure they are safe. And we
Right.
should, the cat always should have a choice if they want to use it or not. So we should never
Mhm.
just put a heat pad in the bed. So always like making sure maybe half of it is heated and the other one no.
Yeah, or one heated and one not heated type thing, right?
Exactly. Yeah, we should
Yeah.
always give them an option.
Mhm. We talked before about, like, we like them to be able to have levels to be able to jump up and down
Mhm.
on. So do you still do that for your cats who have arthritis, or do you just make those levels lower?
Exactly. So I still do it for the kids with osteoarthritis, but I try to provide options. So, for example, if I put those shelves on the wall, and even
Mhm.
if they want to go higher, I just want to make sure that I put those shelves maybe from lower and very close to each other, so the cat doesn't have to jump too much to get to those. So, really
Yeah.
providing those kind of in between steps for them to be able to still go high up, because I think cats are really sad when they cannot go high up.
Mhm.
And all those ramps, like I mentioned before, I really have several clients who build them like these ramps that go from the ground to the window, and then there is a big pillow or like a big bed for them on the windows as well.
Nice. So I know that not everybody's gonna be able to recognize at first that osteoarthritis in their cats. So how can we diagnose it when they bring them to the vet clinic?
Yes, that's a super great question. And most of the times we diagnose them based on our physical exam and like palpation. So when we feel those joints, but radiographs, of course, can be very helpful for these patients as well, because we can see some changes on those x rays potentially as well in those joints too.
Yeah. So we're looking for, like, bony changes a lot of times, right?
Yes, exactly.
Yeah.
And
Mhm.
some inflammation around the joint or soft tissue as well, potentially. I feel like the soft tissue we see more affected with those acute injuries, like broken, for example, bones. But yes, exactly. Those changes are always great to look for on radiographs.
And so what can we do then in the veterinary field? Like, what do we do to help with cats who have arthritis?
Yeah, there are actually so many pain medications now for cats these days. It can be hard to choose from. And I have to say, all of this is always very individual. I've had cats
Mhm.
who opioids like buprenorphine are great for some cats. For some cats, they just do not tolerate them. Cats can have fever, other reactions. They can have
Mhm.
hypersalivation, nausea from these opioids.
Hypersalivation is just drooling, by the way. Yeah.
Exactly.
Yeah.
Sorry about that. Yeah. So they
It's
can
okay.
be drooling. My cat, actually, Bellina, she one time got buprenorphine for cystitis and she goes crazy high on that medication. So
Yeah.
she just was walking around all night, meowing, wouldn't rest. So
Mhm.
definitely some cats can not tolerate it as well. Then we have great medications like gabapentin that we use in human medicine too. And for most cats, it's great. Some cats can really have severe sedation side effect from
Mhm.
that. Kids with chronic kidney disease can be more sensitive to it because it gets processed by the kidneys. So
Mhm.
we have to be careful in those. Non-steroidal anti-inflammatory medications can be great help because in these joints usually is some inflammation as well. And these non-steroidal anti-inflammatory medications, they help to break down the process of inflammation and decrease it. But again, in some cats, especially with advanced chronic kidney disease or gastrointestinal upset, these cannot be always great. And now we actually have a new drug on the market that's an once a month injection of
Mhm.
these monoclonal antibodies. And it seems to really target specific things in their joints and really be helping with that. And I think that really has changed. There's been a huge life changer for a lot of my patients with
Mhm.
osteoarthritis.
Real quick, going back to the non-steroidal anti-inflammatories, for everybody who doesn't know, that's NSAIDs. It's typically like us taking ibuprofen, but something that's safe for cats, right? As far as I know, I think there's only 2 that we can use, right? Onsior and Metacam
And
is
yes,
we use it.
yeah, this is really actually interesting. So it's only this like black box label in United States. So it
Mhm.
was my number one NSAID to use in cats when I worked in UK.
Right.
And I used it all the time and long term, and then I prescribe it here, and our pharmacy would be calling me and, "Černá, did you go crazy?" And I was like, "I just don't see the American cats being so different to the British cats." And so I've actually been using it for a lot of other diseases like cystitis in cats, and when I have inflammations, I use sometimes dose reduce. I'm very careful in cats that are not eating, patients
Mm,
that are not well hydrated. But in a otherwise healthy cat, even a senior cat with mild CKD, we now have several studies showing that it's very safe in cats
nice.
with even stage 1 and stage 2 chronic kidney disease.
Wow. Hopefully, they'll change that then so we can use
Yeah,
Metacam and it be on label to use for cats.
exactly. Yeah. So I think it would be great because Answer is only also on label for 3 days. So
Yeah.
I think we just need to be careful when we use it. But
Mhm.
I've used it even in my own cats chronically, and Belina gets NSAID for after her surgeries, and she's a 10-year-old cat, and we
Yeah.
still use plenty of it too.
Nice. Sorry, now we'll go back to our injection. So the injection, you said once a month injection, right?
Mhm.
Solensia, I wanna
Yes,
say?
exactly.
Yeah,
Yes,
thank
it
you.
is called Solensia.
Yeah, I can never remember. So we have one for dogs, we have one for cats, so I always have to go look to see which one is which. So
Yes, and this was an amazing because actually one of the few drugs that the one for cats came before the one for the dogs.
Oh, really? Oh, I didn't
Yeah.
know that. Oh, that's
Yes, there
cool.
are not that many drugs. So
Yeah,
I always love when there is like a drug that's labeled for cats and we use
right.
it off label for dogs. It just makes me
Yeah,
so happy.
because that almost never happens. We always
Ex-
have things that are for dogs that we have to use off-label for cats.
exactly.
Serenia, yeah, really common medication to help with nausea, and it says for dogs only, but we use it for cats all the time. But people get very concerned about it because it says not
Yeah,
for cats. Yeah.
exactly.
Yeah, so Solensia injections, so we give it once a month.
Mhm.
I've had a couple of I have one cat, my own cat that I've used it for, and a couple of my clients that have used it as well for their cats. I did notice that the first injection maybe didn't work as well, but by the
Mhm.
second injection, you could definitely see a pretty big improvement. Have you seen that as well?
Yes, I see in some really huge improvement from day kind of one, but it
Mhm.
definitely has happened with several patients where the second dose has been more helpful than the first one. And then we usually try to keep them on regular once a month management as
Mhm.
well. There are, of course, some side effects. They are technically often quite rare. So I've not seen them personally, but some couple of my colleagues have seen. I think the worst one that we see would be some itchiness in these cats
Yes.
and I've actually had a couple of my colleagues who are feline specialists said that then they used like a half a dose instead of a full dose, and then the next time, and that has helped, and the cats were still comfortable. And I
Oh,
really
nice.
think yeah, and I've had few patients where we were really considering humane euthanasia for quality of life from their
Mhm.
osteoarthritic pain. And then
Yeah.
we started them on Solensia, and the kids started trotting up and down the stairs again. So it was
Nice.
beautiful to see, and I think it's definitely worth trying. It's not cheap. However, if you actually think it's just once a month, and then you think if you have to pill your cat twice a day and how much those medications cost, it actually comes up almost to the same price.
Yeah. Yeah. Exactly. And do they always I don't know if you know this or not, do you always have to go into the vet to have the injection done, or have you seen people,
Well,
like, sell the bottle to the, pet
yeah,
parent to be able to give at home?
that's a great question, and I think this one is definitely something that as veterinarians we need to be careful about, right? Because actually, like humans give themselves injections all the time.
Yeah. Right.
So I personally am okay with the stress for cats coming in once a month can definitely be
Exactly.
high. So as long as my caregivers or my clients are comfortable injecting those cats once a month, and I've had some where they're like, I don't want to do it at home. It costs X and Z, and if I spill it or something
Right.
happens, like I don't want that to happen. So they bring the cat once a month. But I've had several clients where they've been caring for cats with chronic kidney disease. They can give subcutaneous fluids at home. They've been giving insulin to their cats, so they have no problem giving these injections at home as well. And
Yeah.
actually, I think it's probably for a lot of these kids that are stressful and stress going to the vet, going once a month can definitely be challenging. We sometimes do these as a technician appointments. So the technicians just give the injections with the clients in the room and then they go home within 5 minutes. So we've done that
Yeah.
as well.
Yeah, I've definitely had some clients that their cat gets really stressed coming in to us, and not only that, but now we're at the end of when their injection was working, and so they're also more painful, and then trying to get them into the carrier, it just becomes a big heartache for both the owner or the pet parent who's, like, trying to just make them feel better, and the cat who's just really stressed out from all of this happening.
Exactly. So I think it's not that difficult to learn to give injections at
Mhm.
home. I've
Right.
definitely have many clients who are doing that. So I think I feel comfortable with that.
Nice. Great. Okay, and then so you had said that there are some side effects. Itchiness was the worst. What are some of the other side effects that you've
Yeah,
seen?
I think that's probably like the one where we would see that these cats would really need to stop the medications. There were safety studies in like chronic kidney disease cats as well. So otherwise the side effects are pretty mild and I have not really seen many. So main one really would be the skin reactions like itching, some inflammation, and I think some hair loss has been reported as well.
Is that just in the area where the injection was given, or is it itchiness and all over?
Actually, all over. Actually,
Mm,
all
okay.
over. And I think there has been small percentage of cats that have been reported to have some vomiting and diarrhea afterwards. These are always like hard to say. Is it
Mhm.
actually because when they actually control the Solensia to placebo, some of those kids were vomiting too in the study. And
Right.
I don't because sometimes just like giving any injection to a cat can make it
It's
stressed and
stressful,
throw
right?
up or get diarrhea. So I don't think there was like a huge percentage. I think it was like 13% of cats that had the Solensia and 10% of cats that were in the placebo group. So there wasn't like a
Right.
huge difference between those.
Yeah, and I've also had people who not with Solensia specifically, but doing flea medication. Somebody had
Mhm.
told me that every single time they put the flea medication on, their cat would vomit. We discussed what their procedure was as to how they
Yeah.
did it and was the cat licking it afterwards. So, no, I always make sure it doesn't lick it by giving them this can of cat food that they never get. I was like, "Ah."
Yeah. Yeah.
Call a can of cat food that you just gave afterwards that caused an upset
Yeah.
stomach.
Yeah.
Yeah.
Yeah, no, I know. It's I think it's always hard to say that we've seen this, but I think it's always hard to prove the causality, or I don't know
Mhm.
what's the English term for that, like
Yeah,
that
that's right. Yeah, yeah,
it's yeah, that this is what it actually caused the vomiting.
exactly. Alright, any other things you wanna talk about for arthritis with our kitties?
No, I think we have covered actually a lot of things, and I am hoping that whoever listens to this, if they have a cat with osteoarthritis at home, they are inspired to make their cat's life better.
Right? Exactly. I think the Solensia injection has been amazing. Oh, I did have one other question for you, sorry. Is there any supplements that you have recommended for arthritis?
I That's a really tough question. I feel like
Mhm.
because we live in a country where supplements are not regulated. So I always tell people because I have sometimes clients who come to me and their cat is on 10 supplements. And
Yes.
I tell them I can just mix some sugar and water and start selling it like a magic kitty pill for your cat to live until they're 25. And nobody can even sue me for that. So I
Yeah.
think in this country where supplements are not really regulated, not many people actually put their money into the research of actually showing that these supplements work. And it's not with all of them, but unfortunately it is with majority of them.
Yeah.
And then we actually have not even any control or testing that these sometimes they could even contain like toxic substances, right? Or
Mhm.
be
Right.
contaminated with something. So I personally do not really use supplements very often because I think we just do not have enough evidence that they help and they are not regulated. So I think there are a lot of risks with them actually too.
Yeah, absolutely. Perfect, thank you.
Yeah,
Alright, great.
absolutely.
Yeah, well, thank you so much for answering all these questions about arthritis in our kitties and just, like, how to tell if they're in pain in general. I know you had launched a new website and stuff, so I would like to know, like, how people can get a hold of you now.
Oh yeah, thank you so much. Yeah,
Yeah.
it's the www.crazycatvet.com. So if you wanna check my website out, I would very much love that. We've just actually hosted a first conference this year for cat breeders, and I am planning a couple webinars actually this later this year on feline endocrinology, some infectious peritonitis as well in cats, and hopefully this kicks off well for the rest of the year. I'm hoping there will be much more happening next year as well. So it's a
Yeah.
lot of work, but I'm very excited about this.
You've done a lot just in this year. So
Yeah,
and then I know you're
it's so
pretty
busy.
active on Instagram. I think that's the most thing you're most active on. Is that right?
Yes, yes. I tried. That was my one thing I decided I'm gonna push myself out of my comfort zone this year because I definitely am not a I hate taking pictures, and so I do not put any pictures there of myself. So don't be alarmed.
Yeah.
only put videos and pictures of cats, and I actually have started posting every Friday. We have a feline Friday, so we
Mhm.
talk about some feline medicine disease topics. So last Friday we covered the feline obesity, and I actually am trying to do a lot of feline education to caregivers, but also other vets. So we people can learn about all the diseases cats can get and what to watch out for at home. So thank you so much for mentioning this.
Yeah, and I know you also have been doing ones with, like, different cat breeds, which I thought was really cool, 'cause then you can just learn about a lot of the different cat breeds, the good things and the bad things. I think that's super important as well to know what are some of the risks with some of these breeds.
Yes, I think it's important too because I love pedigree cats so much, but I think it's also important that people don't just look at the cats. Oh, this is a cute cat. I want it at home. Because, for example,
Yeah,
I think Abyssinian cats and Siamese cats are the cutest cats I know. But with my lifestyle and their needs, because
mhm,
pedigree cats are very, very different breed by breed. And I know Siamese cats are so people dependent. And if
yeah,
I'm not home for 10 hours, like I have my British short hairs who are completely perfectly fine being on their own for 10 hours, while a
right.
Siamese cat would probably die of
Then go
stress,
crazy.
not
Yeah.
exactly, or not seeing me, or I do not want a crazy Bengal at my home
Right.
because it's just, I do not have, I feel like currently I do not have the time to dedicate to a crazy Bengal to
Mhm,
take him or her out for 2 hours a day and let them roam
right.
there. So I post these kind of temperament fun facts about pedigree cats. And yes, also there are a lot of genetic predispositions in these breeds. And so I'm trying to raise an awareness so when people go and buy a pedigree cat, that they know what diseases they might have and they should ask their breeders for testing.
Yeah, yeah. And I know for vets, there's also a really cool thing on there too that you'll do, a consultation, internal medicine consultation for cats as well, right?
Yes, absolutely. If anybody needs any help, I'm always happy to help. I actually gave this FIP webinar last night with there were over 400 vets there,
Wow,
and I have
great.
about 30 emails this morning with
Yeah.
consults, so I will have a busy day.
Yeah. We'll let you get back to all those emails then.
Thank you so much, and thank you for having me. I always love to be being here and talking about cats.
Yeah, we loved having you on. So thank you again, Dr. Cherna. So everybody else, make sure to keep your pets happy, healthy, and safe. Thank you guys.
Bye.